Good morning, good afternoon, good evening, depending on where you're joining from. Welcome back to another episode of AMR Unplugged. My name is Musonda Lamba. Oftentimes, when we talk about antimicrobial resistance, the problem seems distant. It seems so far from reality. But this morning, I have with me a guest who will help us to bring AMR to life for better understanding. She's here to share her experience. Mainala Silondwa, welcome.
Thank you for having me.
So I know I want to get straight into the story, but maybe we can start by knowing a little bit about who you are, what you do, before we get into the moment when you fell ill.
I think a word to summarize who I am and what I do would be a storyteller. I think in every facet of my life, from my formative years up until today, storyteller would describe everything that I've done. I spent some time working in radio as a radio presenter. I've been a writer in communications departments in various areas, but I'm mostly a filmmaker, primarily in documentary filmmaking. But at heart, I would say I'm a multifaceted storyteller.
That's nice to know, and it's good to hear your. It will be good to hear your perspective as well later on your storytelling aspect and your personal story as well with antimicrobial resistance. So take us to the moment when what happened really, what really happened for us to be sitting here.
So the discovery of what I had, the discovery that I had a multi-resistant um,
Pseudomonas.
Pseudomonas A. Yes. What led to that was actually a really long journey of ignoring my issue. I was experiencing pain in my ankle for quite some time. And when I first discovered it, I thought it was just one of those things where it's like, oh, I've got pretty weak ankles, age, it's catching up with me. But as time went on, it began to be a very persistent thing where on days where I spent a full day on my feet, um, most definitely the following day my ankle would be swollen and I would be experiencing severe pain in my ankle. And it got to the point where I started to say, when I would describe it to people, I'd say, this pain feels like it's in my bone.
Mm.
Um, and you try to push it away as much as possible, like, oh, I don't have health insurance, or like, what if it's actually serious? I was actually in quite a bit of pain while attending a film related event. And one friend of mine says to me, like, in your line of work, you really can't afford to have a leg issue. You need to
You
get
need to
that
get it
sorted
checked.
out.
Yeah.
It was only months later when I actually did, but I first initially went to get an x ray done and initially was at government hospitals, under NEMA. But eventually, the person who suggested it might actually be more severe than just a sprain, was someone who then pushed me to pursue it through specialist private institutions. But what was discovered was that I had a bone cyst. Essentially, there was a non-cancerous tumor inside the bone
Oh.
where my ankle is, in my femur, and it had to be surgically removed. They said I was high risk for breaking it. If I kept, putting weight on it over time, it would obviously break. And so, um, went on this journey, had the surgery done. And during the surgery, they took some samples from inside the bone and the fluid that, where the buildup and the swelling was around my ankle.
Right.
And the test results came in during my 2-week review. My doctor is looking at the results and is reading through, and her reaction was very, very visceral. It was like, oh, and I'm thinking, what's going on?
Yes.
What's
Tell us a bit more of when she was expressing herself. What was your immediate emotion?
Mhm.
Yeah.
So I think by that point we'd known that I had a bone cyst, and in having conversations with the doctor, and I know it's not advised, but a lot of Google research,
Mm.
it was clear that bone cysts don't have a definitive cause, and usually they're found around amongst children and adolescents, but could potentially have been there for a much longer time and then just, started to experience the symptoms later on in life because, weight gain and different life changes. So that was the knowledge going into the surgery that I had. And so I didn't expect anything to turn up during that test. So initially there's whoa, this isn't how this is supposed to go.
Yeah.
I was prepared for an all clear, everything's fine. One, it's not cancerous. Two, we didn't find anything. You just need to recover from, the fact that we just took out, part of your bone and put a graft in there. And that wasn't the case. So on the one hand, it was, a bit of surprise. On the other hand, it was, oh dear, like if the doctor is reacting this way, then surely it must be something be something big. When she did give the information about what it was, when she explained that on the cultures test, what had been found was this bacteria, Pseudomonas A, which is resistant to several different antibiotics. And she went down the list and it's like this group of antibiotics resistant, this group of antibiotics resistant, this grouping of antibiotics resistant. And a couple said like intermediate, but that means that it's a touch and go, is not a definitive solution. And only 2 antibiotics on this really 4-page tests with several different groupings of antibiotics.
Wait, you had 4 pages
Yes,
of a list of antibiotics that were resistant.
So the test results is 4 pages.
Of course, yes.
It's about maybe 2.5 of various antibiotics that, all but 2 were resistant or intermediate. 2 of them came up as sensitive. And, she had expressed how one of those 2 is unlikely to be found within the country. And she said that, I should try and look for the other one. It wasn't one they had in stock at the hospital, at the specialist hospital. So that began the journey looking for the medicine in pharmacies.
Wow. So you find out that you have a drug-resistant bacteria, Pseudomonas A, and you are presented with a list of antibiotics that are resistant to this bacteria, and then some hope that there's at least 2 antibiotics that could possibly cure, but one is not even available in the country, and the other one you have to go out to find it. They don't have it in the hospital. So take us on the journey of how you found this one possible antibiotic.
My initial instinct was to go to a pharmacy that's relatively large that I've previously found medicines at, and they said they didn't have it, but they suggested one in town that they suspected would have that in stock. And so fortunately, the friend that I was with knew someone that worked there, made a call and, just asked ahead of time, do you have it in stock? How much do you have? And what would that look like cost-wise? Because the doctor had essentially prescribed for me to have 3 days worth of doses, which is 2 doses per day. And what she had said is it's an injectable. And that it would either have to be taken IM, so a jab in a large muscle area, or IV. And my preference was IM. So I after receiving the feedback that yes, they did have it in stock, and we found out the cost. I think the initial calculation had been 400 and something for the total.
Okay.
Yes. So I think one dose was about 60 to 70 kwacha. May have actually been 80, because what I do recall is we went to town, which was challenging to navigate because parking in roads like Freedom Way and Cairo Road
is really crazy.
Yes. So for a good chunk of the way, I had to, on my crutches, taking various breaks, because
That must have been hard.
yes, because after my surgery, because the ankle is a weight-bearing joint, I was not allowed to put weight on my foot for 6 weeks. And this review was just 2 weeks into that 6 weeks. So I was...
So you were fresh from surgery.
Yes,
and going out to look for the medicine on your own.
Not on my own,
with a
with
friend.
support, yes. But yes, I had to physically, I wanted to physically be there,
Yes.
because I'm one of those people who wanted to be a nurse when I was younger. My mother's worked in public health all my life. And I think a big part of whenever I have any ailment of any kind is to be fully aware of what's happening, make sure that I'm giving all the information between health practitioners. I think there's a bit of a sense of wanting to take ownership there. So yeah, I personally went with the person who was there to support me, and it was tiring, but eventually got into the store and had to wait in a bit of a line. It was very busy. But once, I was able to explain what it was I was looking for, they actually offered me a bit of a discount. I think because I was ordering 6 vials
Right.
of the medicine, he was, usually they'd set it at a certain amount, but then I got it for 70 kwacha per vial, because it was 2 doses per day for 3 days. It totaled to about 420 kwacha. And yeah, so eventually was able to get those. Again, they just give you the injectables. As far as how it's going to be administered is something that I had to decide. So the hospital where I was getting the treatment done for my cyst was an option, but because it's not that close to home, was something that I thought might be a more expensive option. And so there happens to be a clinic literally in the next road from where I live.
Yeah.
And I was able to speak to them about, how much does it cost to get this administered IM? And they said, well, for the jab, if you have the medicine yourself, I can't recall the amount per jab, but it totaled to about 150 kwacha.
Wow.
Yes.
So I was listening quite attentively, especially when you were talking about the costs of what it cost. It costed you to buy the medicine. It costed you to get the medicine administered, and I can imagine even moving up and down that must have costed something as well. Um, it got me thinking on in the discourse of antimicrobial resistance. We often talk about something called access.
Mhm.
You know, a lot of people, especially in our setting in Africa, Zambia, low and middle income countries, there's often a problem with access to medicines and medications. So in your situation where you were already set up in a situation where the availability of the drugs that could have helped you, to feel better and to cure this bacteria, they were they were limited. It was limited resources, and so it just got me thinking. Also, cost wise, for people who are in settings, thank God that you were able to to get this medication because you could somewhat afford it. I know it must have still been something, right? That I can't imagine that it was just easy, like, oh, here's my 100 kwacha, take it. But just thinking back and reflecting on people in lower resource settings who are not able to have access to this medication, when if in a similar situation like yours, they are already set up in a position where it's even difficult to access the few resources that are available. So just thinking around that. What about emotionally? We've talked about the financial aspect. What about emotionally? How did this whole journey feel? The looking for the medicine, yeah, having to think about which hospital is the best place, or clinic, hospital. Yeah, just take us also on the emotional journey from surgery, looking for the drugs. How did this impact you emotionally?
Um, Overall, mixed emotions. Lots of different emotions. One that I will say stands out is relief. It was, first of all, relief that I knew what exactly was wrong. For several months, it was just pain in my ankle. So it was relief that I knew what was wrong. And then also relief that I knew about this bacteria. If I hadn't had this surgery, I think I wasn't experiencing any symptoms from the Pseudomonas A.
Yeah.
If you read up on some of the symptoms, I wasn't experiencing any of those. So I don't know if I would have ever known. Maybe I would have only found out when things had gotten severe.
That's scary.
Yes, and
Yeah.
so I think relief that the surgery was able to provide information that this was something that I actually had. Relief knowing that despite how limited the solutions were, there were solutions. I think Relief is one that stands out for sure. So not fully knowing, not fully knowing if we would find the medicine, if it would be in stock where I had gone to look for it. Uncertainty about how long, it would take for certain things to happen, how long it would take to heal,
Yes.
how long will it take to close, will there be an infection? So yeah, uncertainty was definitely something I experienced. Another big thing is that I did take the course of prescribed antibiotics for the 3 days. However, because the sample where this bacteria was found was from inside my bone, it's something that we're unable to retest. So I'm literally living by faith that the 3 days of this dosage of the antibiotic took care of the Pseudomonas A. I think as far as where specifically it came from, there's speculation. Usually it's something that is obtained during a hospital stay. Other people say that it's also something that's often found in soil and
Yes,
it's
in the environment.
yes, and it's usually administered through some sort of piercing, an injection or a prick or so. When the doctor first, discovered the results at sort of the same time that I was finding out the results, she had asked me, was there ever an encounter where you got a thorn prick? And there was, during my journey of filmmaking, I was filming in South Luangwa and just sort of outside my tent stepped on a thorn and it got right through my slides and right pretty deep into my foot. And so, there's a chance that this was when the Pseudomonas A was introduced. But we can't know for certain, how it entered. But I think I wouldn't have known that I had it had I not had this surgery.
Yeah, that's really powerful. But what's it like living with the uncertainty that, because then you said you can't retest if to see that it's gone for real. So what is it like to live with that uncertainty?
The way I look at it, and maybe this is that hope thing, but the way I look at it is that, I've been living with uncertainty anyway. I for 2 years or more was walking around with this bacteria not knowing I had it. And so I think for me, it doesn't make too much of a difference. I think it's important for me to try my best to be intentional about living a healthy life, and make decisions that, can optimize my health. But outside of that, I think we're all sort of living with a level of uncertainty. Another one that I think I wasn't prepared for is in these journeys. I mean, hopefully you are part of a community. Hopefully you have family and friends and people who love and support you. But on these journeys, you're not alone. You're personally experiencing it. But other people are also experiencing
in a different
their own thing around it. They're experiencing their own uncertainty. They're experiencing their own nervousness around it. Fortunately, I'm relatively privileged, and I'm not in a space where anyone was depending on me. I don't have dependence in that sense. My all my financial gains are primarily for myself and hopefully for my future. But that's something that I think about, for people who are in situations where they are a provider, they are the person who people are relying on.
Yeah, and you had to get off work, right? Because of the surgery.
Yes.
So,
I, again, privileged. I was fortunate that I was in formal employment and that I had a contract that stated that I was entitled to sick leave. And sick leave is, the specific sick leave I was entitled to is fully paid sick leave for a certain period of time. Because I had a doctor's note and, everything was in place, I was able to get 2 months of sick leave, where I took time off work and, still received my salary. But in instances where someone, doesn't have that in place, if they're not in formal employment, if they don't have that kind of agreement, I can imagine the level of uncertainty, the level of shaking that takes place in an instance like that. So yeah, I guess gratitude would also be another emotion that I experienced. Gratitude, uncertainty, relief, and I guess also just there was a sense where I felt like things that I might have allowed to hold me back. I said earlier that I'm a filmmaker, but I haven't been working in film for quite some time. And, was sort of just trying to ensure that I'm doing something to pay the bills. But being in this scenario where there was so much uncertainty about life, about my future, will I be able to walk properly again? Will I be able to regain that level of mobility? I think really just made me take a hard look at how I was showing up for myself every day, how I was showing up in life every day. And, when I recover, I need to give this thing my all. When I recover, I need to do things that, bring about impact and can feel worth it. Because you take these things for granted. You take getting out of bed and walking for granted. It was humbling. It was very humbling. I had to rely on so many different people, and I'm grateful that those people were
that
there.
you even had people to depend
Yes,
on.
they
That's
were
true.
they were there and they were reliable. But yeah, it also challenged me to then want to be that person for other people as well.
If someone is watching, and you feel free to look into the camera and speak directly to the audience, but if someone is watching who previously thought that antimicrobial resistance is just this concept from the lab, this highly scientific phenomenon, this problem with big statistics, but somehow just doesn't make anyone feel anything, especially from the perspective of a storyteller. What would you want to tell people about your personal experience with antimicrobial resistance? And yeah, what would you say to the people?
So there's a group of people who doesn't actively think about AMR. And to those people, I would say, it's easy to not think about things until they affect you directly. But I think it certainly helps to have some level of information. Um, Obviously, there is a lot of information, and not all of it is true. There is some misinformation as well. But I think it certainly helps to have a level of information to ensure that in your day to day life, the decisions that you're making and the things that you're doing are protecting you. My instance is slightly different. I was in a situation where the reason why I had this bacteria was not one that was, caused by a specific decision that I had made. But there's other things around AMR where it could be induced by decisions being made. I think we talk a lot about taking antibiotics that have not been prescribed, and I think just decisions like that are ones that could make you more susceptible. And so I think getting the little information you can from the spaces that are offering it reliably is definitely one thing to do. I can personally attest to how there's still a lot of work to be done as far as access is concerned, and ease of access and ease of service in the healthcare space. But ultimately, I was able to find the solutions to my problems in Zambia, and so I would say options are there. I think one really big thing is hope. To not give up hope, to be solutions oriented in the way you go about your journey. And I think it's also just really important to know that that plays a huge role in how your body recovers, in how your cells and every bit of you takes to the recovery process. I think giving up hope or feeling sorry for yourself can negatively affect the process. You know, it plays such a big role in the decisions that you'll make, in what you'll eat, and what you'll decide to do. And I still need to be active with the rest of my body, even if I'm not allowed to put weight on this one part of my body. Those are some of the decisions I had to make. So I think those would be two big things I would encourage: is ensuring that you're getting information that's reliable, and then also ensuring that you exercise hope.
Ensuring that you exercise hope. I think for me, that's the biggest takeaway from today's conversation. In light of everything that you experienced, we're so really grateful for you to come and share your personal story, your personal experience with antimicrobial resistance. I think I keep saying this because it's real in our little bubble of antimicrobial resistance, that there's not enough stories that are being shared about people who experience treatment treatment failure, long stays in hospitals, access to struggles with access to medications and good health care. So it's really very important for us to bring more people like you on this podcast, bringing AMR closer to people, showing the emotion behind the personal struggles that people experience on a day-to-day basis. So thank you so much for coming.
Thank you for having me.
And thank you so much as well for watching up to the end. This has been AMR Unplugged. Be sure to follow us on our social media platforms. That's React Africa everywhere and RunTube on YouTube.